Good morning, every medical students. Our lecture will be on principles of neuroimaging. Our objective, first of all, we will discuss about the common imaging techniques used in imaging of the brain tissue. The second one is that we will discuss about the principles that underpin the two most common imaging approaches in the daily practice. The third one, we will discuss about the advantage and disadvantage of each of these imaging techniques. The fourth one, we will discuss about the distinguishing between the CT and MR scan of the brain and the difference between of them, and how to discriminate between the two medical imaging. And then we will go to a systemic approach to diagnose brain imaging lesions. The imaging modalities that are available and commonly used, the first one is the X-ray of the brain or the cervical region. So the problem of the X-ray is that it is very low accuracy imaging technique, and it's very non-specific. So it's very easy to miss a fracture, for example, or the skull or the base of the skull by the X-ray, but it may give you hint of linear fractures that are very evident. And although there are some pitfalls and difficulties to distinguish between the fractures and the sutures lines. The second imaging is the CT, so it's computed tomography, which is also using X-ray, but it's more accurate, and we are usually use it in emergency, and it give you too many details about the trauma to the brain. The third one is the magnetic resonance imaging, which is called MRI or MR. Actually, it's the best and the most accurate imaging modality of the brain. And even it can detect the foci of epilepsy than if the patient comes with epilepsy to the emergency. The fourth one is angiography. It's conventional angiography. It gives you the definite diagnosis for most of the vascular lesions, for example, aneurysms or vascular brain tumors, that it will give you the details or the origins of the blood supply to that tumor. We have not to forget also the ultrasound. We usually use ultrasound, which is it is easy and available, although it is depending on it is personal dependent techniques, although it is one of the very important modalities, especially in neonates and infants. So we are going to have a window for imaging of the brain tissue through the fontanelles, the frontal or the occipital, the posterior fontanelle, sorry. And also, it's very important in adults to use Doppler ultrasound for carotid vessels and even for circle of Willis. We also, although we don't use it commonly, is isotopes. So it is a nuclear medicine, and we can use PET-CT or SPECT. The PET-CT is a positron emission tomography, which is not available in our city. It's available actually in Airville. The plain X-ray, as we mentioned, the problem is it is very non-specific and they may easily miss cases, although we can use it for fractures, for example, cervical fractures. It gives you a very good technique. It's a good techniques for detecting the calcifications, which could be physiological or abnormal as a pathology. Also, it gives you the fracture lines, although it is not easy to for some of the fractures to distinguish it between the suture lines and even sometimes vascular marking. And also, this is a picture of CT scan. It's a new one, CT scan. It's from the Siemens company actually. This is the gantry. Actually, this is the gantry, and this is the bed that the patient come inside and go outside, and it's very fast technique for imaging of the brain. Actually, the CT is an X-ray study, and it can give you a rotation and give you a picture of 36-degree manner, and it can reconstruct the imaging in 360 degrees terrain. So it gives you in a thin slices, and it can reconstruct into imaging of coronal imaging and sagittal imaging. And actually, its principle is detecting, and it's depending actually on the density of the tissue. So we discriminate between the different tissues and even pathologies according to the density. And density, it means the whitish يعني سبيا تياوي أو density عندي سبي بيتن أو more dense وكي hemorrhage وكي بوني وهندي راش بيت أو low density وكي فلودي CSFE وكي fatty أو بيتا minus. So we have a Hausenfeld unit مع هاي and we measurement gain for the density of the lesions and even normal tissues. So it's unlike the plain films. The CT can differentiate between soft tissues. So it's give you the direct visualization of the intracranial contents and the pathologies inside. So the cortical bone here appear white color. And just like here, which skull is give you the whitish color. The guy right is give you some of the less density, and the sulci is less. The supracondylophys is minus, and the skin is give you some higher density. Cerebral white matter appears slightly darker than gray matter. Actually, the gray white matter T2 دا نفس السي تي در كبيت ام چه دزانی يعني white matter it's darker بتكي راشته در كبيت سي تي دا و T2 دا امبارد. So CT brain, when we do CT brain, so we have brain tissue window. ام دشين بشينجي كينا windowing او جي كمبيوتر عند بيجيب كينا بون ويندو مثلا تشيستي دا چاو ما ميدياستاينال ويندو هاي چاو ما لانك ويندو هاي بون ويندو اول فيريجي ام بيجي برين تشيو ويندو انجي سيربرال ويندو ما هاي برين ويندو وهاي بون ويندو جي تشينكي اول هاو جالك مهما بو fracture to detect the fractures and also at the same time to detect the intracranial associated intracranial hemorrhage. So we just give an order to the CT machine. It's just within moments it will change to the other window. So the brain tissue masses and any lesion inside, we will go for brain window. And if you go for detection of the bone lesions, fractures, so we will make it bone window. Okay, تسحكي يبقى brain tissue دستيجابيدا ديارة واضحة كورتكس واضحة نافدا سي اس اف وابتشامت واضحة شكبا brain tissue window يادي تسحكي details you cannot see on your right side بس to bone window details of the bone you can see and any lesion inside or fracture. So this is اكو اذا فيلم كما بسكونكي اكو when we see it when you are in emergency hospital, so they will bring you a film of CT. For example, it will appear like this. For example, in the upper left, there are cerebral tissue. Then the second line also the same. The third line, the second or your right side, three frames or your right sides, they are brain bone tissue window. Intracranial pathologies conditions can be either on the rush در كبد hypodense on the speed در كبد hyperdense وهنا جا and بعدين isodense يعني وكي brain tissue surrounding tissue. The most two important in emergency hospital is acute cerebral infarction هاكو در كبد راش در كبدن وكي كتو سحكي لس شبه لويري وكي wedge shape ده لويري در كتي راش يعني low density بس هكا if it change to hemorrhagic infarction the speed نابض در كبد أو hemorrhage very dense especially in the beginning. So in your left is acute ischemic infarction, in your right side it is hemorrhagic. So it's very bright and speed. The problem with the CT is the patient exposed to ionizing radiation and sometimes to iodine-based contrast agents. So the contrast reaction on renal failure بتنشب أصلا on renal impairment if you not worry about if you don't do precaution about that. وإجبار radiation يجي همي قوا بريم فريكين. We have to think about the radiation. We have to think about whether the patient is pregnant or not, or the childbearing age also, and if too young, it's more sensitive to those. They are older. Also, we have a problem with the artifacts that can be seen. For example, in the posterior fossa, we have too many streak artifacts, and sometimes we overcome it, sometimes we cannot. We shift for MRI. So we have also retain braces كان on the filling باقي حشو جماعة الدكتورة ظانا الدنتستري حشو أو حشو أسبي هبو شيء amalgam هبو يو كي metallic give you streak artifact وكي metallic artifact ده ونجا surgical clips تقدر هبن أنجي تصاجمها بيت أو artifact ده نمبر بينجا interfere with the detections. Even in lumbosacral sometimes والسكرو after شامل كان artifact. They may obscure the abnormalities. Although it's not common, but sometimes. The indication of the CT, usually in acute emergency cases, we use it for some of the reasons commonly used for head injury, or we suspect sometimes intracranial infection, or intracranial hemorrhage is very important. Strokes, especially if it's massive, it can detect it. همي جرادين CT double checking فرق CT first line جبرتش to exclude associated hemorrhage وده مثلا mass habit mass effect habit أو is important to be seen by CT. It's easy available although we have to think about the radiation بس باش شوية it will exclude hemorrhagic infarction. So we can start with the treatment of ischemic strokes. عندك MRI is different. So it's more clues target سحكي gantry girti ترى بتيجي طاري ترى جبرندس claustrophobia. We have a problem with that. Or it takes time. Within 10 minutes, 15 minutes. Some of the examination even 20-25 minutes. The whole body MRI, for example. So about 5 to 10% they may have claustrophobia, although we can overcome that by psychological supports, and sometimes even some patients, adult patients, we use sedation inside the MRI processing. And this is the insight and how it's working MRI scanner. it emits, the CT emits X-ray, and it will be detected by detectors. But here they are depending on the hydrogen ion inside the body tissue. So we have radio frequency coil, we have a big magnet, we have Geridian coil, we have surface coil, so all these can detect the MRI pathologies, and the problem is taking too much time if you compare it with the CT. Actually, the MR is very important for neurological disorders. It is very sensitive, and actually it's the gold, and it's the cornerstone for the neuroimaging. The MRI, it will give the information as we mentioned. It's not depending on the X-ray, so you can use it even in pregnant women, especially after the first trimester. Although we cannot give the contrast, which could be teratogenic for the patient, for the fetus. So no MRI contrast for pregnant women. MRI also, it is, as we mentioned, it's depending on the hydrogen atoms inside the body tissues. We have the main two sequences is T1 weighted image and T2 weighted images. So شنو معي T1 fault suppression معي B fault suppression معي T2 fluid suppression معي أو بيجي flare شنو معي gradient أو جي همي T2 ما قالك sequence هين بس همي شفيتنا اقتباس كده. MRI T1 دا فلوت راج دار كيفيت وكي تشوفي وكي سي اس افي يعني جلوب فيتريوس دار كيفيت سبي T2 دا دار كيفيت راج T1 دا. So this is very important. فهنديك فاتا it is bright in T1 and T2. جبارن ده كما تشتكي برايت ديت تشبيت بلاد بيت انجي تشبيت فات بيت عم كنا فات suppression هكا تشو أو فاتا هكا نتشو أو بلادها. These are some of the principles that we have to know it. Cortical bone يراشا تشكي هيدروجين أيون جالك يمت داهين جبارن ده در كيفيت سيجنال نودتا جبارن در كيفيت دارك. وحتى ميتاليك اوبجكت كان جبليت كان ارتيفاكت بس راج در كيفيت تشكي سيجنال نودتا هاروصا كالسيوم جيوساي برين تشو intermediate intensity بارابتر ام چونکی CT دا مگو density ام MRI داد بيجين intensity يعني signal high signal low signal vessels it depends on the velocity of the flowing so it's not constant. كسحكي دست تشابي this is T1 ام chosen T1 چكي white gray أما T1 دزوني يود عكسه أو T2 كتو سحكي CSF also is very important. CSF يراشا T1 دا هر فلودك يراشا هنديك T2 دا يسبيع. So this is all the basal ganglia. This is the gene of the corpus callosum. This is the thalamus. This is the splenum of the corpus callosum. The normal MRI usually we have T1 or T2 and T2. So this is on your left is T1 and your right side is T2. We have MR angiography, MRA. We have two ما هي بي contrast am ديني دي MRA ده كيف تو contrast جي أو it depends on the sequence ما هي time of flight أو detail anything بس أمشين MRA checking بي contrast MRA ده. هذا picture كي MRA. This is circle of Phyllis MRA. So this is a middle cranial artery and the other is anterior cranial artery ACA. Posterior cranial artery ما هي basilar vertebral right to left it. Okay, to they are عندك hypoplastic in one side and the other is dominant. So they are the middle cerebral artery, as we know, and anterior cerebral artery. They are coming from middle cerebral internal carotid artery. We have some of the sequences هكذا تحكي بين بيش تشوف هكذا بعدين دست تشابي سيت سكانه بس دست راسته بشتي خاطي تي وانا تي تويا فلير ما قلتي فلو سابرشنا تي تويا بس فليت سابرش عم تشوزوني فلير أنا تي وانا دي بعدين سي في راشا دي بعدين جري موتر نجري ووايت موتر جنا وايتا بالعكس يعني وكي تي تويا شبه عم بيجينا تي تو فلو سابرشن عندك سيكونس دي جماعة هي وكي gradient GRE gradient equal of the sequence using in hemorrhage and calcification the proton density. MRI indication all the cases of suspected intracranial pathology we have to do MRI except for those CT indication ما هاي النكتين كو we use CT I'm not sure MRI by metallic CT دا نوعي MRI فيتو ساجيتالي جدا تشيكي اكزال جدا كورونال جدا و تشتباش بون ارتيفاكت اوينينا better best soft tissue resolution MRI ده مشكلة particularly in the posterior fossa ام حالت كيم CT MRI okay CT ده هابتن pituitary gland is very higher resolution and MRI تشيكين و any white matter disease MRI is the best. For children, actually we have to make a balance. Chiki children are the CT دا within seconds دي خلاص كي تبي بس بتشي خلنا الريت ما بتشيبه بس MRI دا we have to give sedation and the general anesthetic. Most of the time they come for making the patient immobile. The disadvantage of MRI, if you compare with the CT, calcification we cannot show or it's very weak. Lack of the bone details, especially cortex, MRI ده ماشين أم CT. MRI most of the time is more costly, time consuming. It's not available all the time. ولو قابي يعني even in private sector MRI و CT تقريبا يشتيك لها تنيزكي بوي. It's globally now internationally بس دفما بعرف ندبرشت. And seriously ill patient نجات نشي مونيتور بيفا ديت بيفا أكسجين بيفا ECG ديت بيفا leaded way. Well, it can make it difficult to put the patient for 10 minutes or 15 minutes inside the gantry of the MRI. Because there are some contraindications, مثلا clips with MRI non-compatible for brain aneurysm to نشي contraindication, for example. PET-CT, although we don't use it commonly, but it's give you the function of the lesion rather than to give you anatomy. The PET-CT, it depends on the metabolic activity of the tissue examined. So بعد the tissue FDG والجريت يعني 5 fluoride glucose والجريت on بيجا metabolism lesion الداخل PET-CT. For example, this is on your left MRI, and your right is a PET, the same lesion. It's give you, this is fusion imaging below, so it's give you that in the left side, or سهم ساق, or arrow. So this the lesion is foci of convulsion, maybe this area. So we have to know the practical approach. How do we analyze the section, the sectional study of the head? The key point I'm desperate يعني بتشارتشيني. The مهمة determine يعني the patients, you have to detect it, يعني determination of the type of the lesion, نحكي كان شوية, و detection of the pathology of it, you have to detect it. شنو description of pathology عندكين مثلا هاي لويا invasion كيريا نكيريا mass effect هانينا بلطة إنا contrast والجرتيا والنجرتيا. So we give you differential diagnosis and the professional, يعني most likely diagnosis. Abdominal CT and MRI abnormalities. The cardinal sign of abnormalities أولا the altered tissue density اعتماد الكيناوي انجي intensity MRI ده mass effect وكما قلت بقى هي عنينا ventricular enlargement هي عنا. In general approach we have to check for the sulci and the gyri يعني تحكي right to left comparison كاين midline shift هي عنينا دي بعدها medial structure كان الميدل هنا عنا lateral ventricles symmetrical and asymmetrical focal parenchymal lesion هي مثلا right side يهبط left هنا وسيستيرن جد مهمة CSF سيستيرن كون obstruction or no obstruction عشان صار قالك مهمة. So for this is on your left is a CT scan or for the normal patient هكذا بعدها right side بعدها ventricle بتشيك dilated sulci بتشيك dilated صح you will detect that there are some of the dilatation or beginning of the brain atrophy هاي compensatory dilatation of the ventricles. Our classification you have a pineal classification. It is common and it's not important. So we have to detect the abnormalities. We have to say is it diffuse lesion or it's a focal lesion. This is important. If a focal lesion, so is it a solitary or multiple? Is it SPIA on Russia and hypodensa rush on G hyperdensa SP mass effect هي عنا و surrounding edema هي عنا. These are very important to discriminate between the tissues. Is it مثلا كان بشينكي مثلا if you see that the abnormality is diffuse on G focal هكذا diffuse بيتن مثلا بعد atrophy edema meninges شوية مثلا is taking contrast meningitis مش بعد CSF تحكي مثلا hyperdensity تدهي أو subarachnoid hemorrhage. So this in your left is diffuse lesion تحكي ventricles نموينة sulci نموينة effacement of your cheboy تحكي أما CSF نمو أو diffuse disease يعني edema in your left. Right side now بتحكي بعد atrophy cheboy ventricle بتحكي dilated sulci Selvien Fischer تحكي أو ما قلت يا classification is normal. هي midline أو الميدل يجي أو هم normal سحكي نو بين كتو سحكي مقارنة بكي ventricles normal تصننا your right بتحكي dilatation هاي left they are compressed. If you see this image also there are huge dilatation of the lateral ventricles on your left and even in the right side you can see there is a diffuse abnormalities. But about the white matter is frontally سحكي is abnormal. نوع بين white to gray matter with dilatation of the CSF هكا focal lesion بيتن بعدين ما قلتي on solitary or multifocal مثلا solitary برابطر brain primary brain tumor multiple ben أو برابطر metastatic so we have to correlate it with the clinical finding which is very important. If the patient has for example primary habitant or the lesion the lesion these are secondaries بس هكا to primary inhabitant we have to think about other lesions primary brain tumor for example. So we have to know is it hypodense hyperdense and it's beyond Russia or if you compare it with the surrounding. For example this case is hyperdense and it's PIA so this is acute intracranial hemorrhage. إديما هيا عنا ما قلتي يانجي ماس إفكت هيا يانجي هاردو هنا عنا هكا إديما هابيتن دوما دوغوي بتا digitation or finger like أو معنى it's rapid growth so it's aggressive tumor جاب aggressive on metastatic on high grade هكا اكتني بيت metastatic وابت multiple ونجا abscess جي إديما يجالك but there are some features clinically you can differentiate between both although ما هي MR spectroscope I'm the differentiation again. With the fusion يجي abscess زيادة بتاع restriction دي دانا restriction most of the time. It's also important absence of the edema is more going with benign lesions or even low-grade brain tumors. For example, on your left, سحكي lesion هي center dormandoris rashotya ياولي ايزو ياو brain tumor dormandori it is hypodense أو معناه edema كتو your right side سحكي hypodense lesion أو سهم كلسر بس سحكي edema dormandori نينا جاكو مثلا maybe like infarction بيتن يوكي كيفن بيت أنجي شي بيت low grade tumor شي هواك. And then we will go through some of the significant or common, maybe not significant, or sometimes arachnosis ما هي arachnosis تمسسته فلودة يعني it's give you features of CSF but it is in abnormal site. وقت congenital usually is incidentally seen asymptomatic but sometimes it's become large and give you some symptoms. Arachnosis is CSF يعني T1 دي بتا low T2 دي بتا high وكي CSF و CTH ده نفس وكي CSF ديتن عندي راش ده كبي dark. Most of them they are in the middle cranial fossa but sometimes in the posterior cranial fossa. Okay, to سحكي بقى left side بعدها this is CSF وكي CSF cisterna وكي it's just like fluid. So this is left side arachnoid system middle cranial fossa. أبد T1 ما قلت MRI جداد بظن arachnoid cyst شو كبيتن. سحكي on the left side T1 weighted وكي fluid there كبيت رش وكي تشوفي هكذا compare كي globe of the eye and on your right side the MRI in T2 T2 weighted imaging تسحكي نفسي eye there كتي ويس نفسي CSF. So this is arachnoid cyst. Or sometimes for high-grade tumors, for example, on your left side, lesion is hypodense يعني رشا بعدين most affect midline shift هاي و contrast ما يداي on the right side سحكي شو enhancement شيربيتن or surrounded by edema. So this is high-grade glioma عم بجني GBM on glioblastoma multiforme. Most of the tumors they are hypodense ويشبلي lymphoma وmeningioma sometimes. بس infarction ده كبيتن rush dark hypodense it's low density gray matter white matter اللي منطقة ده كبيتن both of them. So if it's ischemic it's hypodense it's wedge shaped وده بعدها territory of arterial territory that can distribution. For example, this one it is territory going with territories of the arteries. Also, this is diffusion weighted imaging on your right side and the left side is CT scan. CT scan measure that can normal, but at the early infarction, but it is great the MRI for detection of the acute infarction. Even within minutes, it can detect the infarction site. So, intracranial hematoma magoti, CT is more accurate, or first choice of imaging, as you mentioned, or as first week barabter USP, and over time, second week bita decrease, bita isodense, pshinge, third week bita hypodense. This is Rajda. For this is basal ganglial hemorrhage, acute hemorrhage. This is trauma, for example. So the first line is CT. And actually, it's indicated for every significantly injured patients. CT بوشيتكين conscious for those they are deteriorating in consciousness and worsening of the neurological signs, that's neurological deficits. CT performed without preparation and be contrasted ديني رأسا بين جربة و bone or brain يعني brain or bone window hardcore they are very important. Role of CT in the head is great, is head trauma, fracture, hemorrhage, and other associated injuries like contusion. It will detect easily. So this is an example of the bone fracture, the breast fracture on your right side, bone window, your left side is brain tissue, it's hypodense, significantly injured. Intracranial hematoma include مثلا extradural, epidural anbijne, subdural, subarachnoid hemorrhage, أهمية intracranial hemorrhage, intraventricular, intracerebral. Like this case is extracerebral, extradural, epidural hemorrhage. أجي تحكي it's biconcave هذا it's lenticular shape, it's limited by sutures, and they are usually associated with fractures. Like this case, we have subdural, it's a meniscus shaped, it's not bordered without not limited by fissures, and less associated with fracture. Not necessary to be associated with fracture. Subarachnoid hemorrhage, CSF فاضة تساكي hyperdensity أو bladder. In the basal cistern, they have the hyperdensity. Intracranial, intracerebral hemorrhage, lateral ventricle, posterior horny, fluid level, third ventrically, or frontal horns, they are containing hyperdensity. So it's very great to detect the lesions, whether it is extra or epidural or subdural or any metallic injury, any associated fractures, if subarachnoid hemorrhage, it's great. So take a home message. The CT is the first line for brain trauma because it's available and detect the associated hemorrhage, detect the associated fractures, and it's easily can be done within a short time. But the details of the lesions and contrasting between the tissue, MRI is the best. And as a first line, even in trauma and medical emergency, CT will start with CT because we have to start with whether to give blood thinner or not, or مثلا ischemic or non ischemic. We will start with the CT. Thank you very much.